Script 15. 5 things happening in your brain right now that your doctor has never mentioned. Dr. Favor Clinton, 4,000 words. Your last brain scan was normal, or perhaps you have never had one. Your memory feels adequate, your thinking feels clear enough, and nobody around you has expressed concern. By the standard measures of cognitive health that most medical appointments use, your brain is fine. But here is what those standard measures do not capture. 5 specific processes are happening inside the aging brain, beginning as early as the 5th decade of life and accelerating through the 60s and 70s, that are entirely invisible to routine clinical assessment, but that are laying the biological groundwork for the cognitive decline, the cerebrovascular disease, and the dementia risk that shows up in the decades that follow. These are not hypothetical processes. They are not speculative risks. They are documented, measurable, and increasingly well understood biological changes that neuroscience has been mapping with increasing precision over the past 15 years. And they are changes that almost no physician discusses with patients in a standard appointment, not because the information does not exist, but because 15 minutes is never enough time to explain what they are, why they matter, and what anyone can do about them. Today, I am going to use this time to have the conversation your appointments have not made room for. 5 things happening in your brain right now. What each one is, why it matters for your cognitive future and your stroke risk, and what you can do, specifically and practically, to slow each process down. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and brain health after 60 is one of the areas I believe receives the least proactive attention in medicine relative to the impact it has on quality of life, independence, and longevity. That is the gap this video is built to close. Let us begin. Before we go through the 5 processes, I want to establish something that is important context for everything that follows. The brain changes that occur with aging are not uniform, not inevitable in their consequences, and not entirely beyond influence. This is the piece of information that most people are never given, and its absence produces a fatalism about brain aging that is both inaccurate and counterproductive. Yes, the brain loses volume with age. Yes, white matter changes, the alterations in the connective tissue of the brain that appear as bright spots on MRI scans, become more common with every decade. Yes, the blood-brain barrier, the protective barrier that keeps harmful substances out of brain tissue, becomes more permeable. And yes, the neurovascular unit, the intricate partnership between neurons and the tiny blood vessels that supply them, becomes less efficient at regulating blood flow in response to neural demand. But the rate at which these changes occur, the degree to which they translate into functional decline, and the timeline over which they accumulate into clinically significant disease are all profoundly influenced by factors that are modifiable. Sleep quality, blood pressure management, inflammation levels, metabolic health, physical activity. Each of these variables affects the rate of every one of the 5 processes I am about to describe. And affecting the rate, even modestly, over years and decades, produces outcomes that are dramatically different from what passive aging alone would produce. This is why the conversation matters. Not to frighten you about what is happening in your brain, but to give you the specific understanding you need to influence what happens next. I want to tell you about a patient I will call Evangeline. Evangeline was 66 years old when she came to see me, not at her own initiative, but at the insistence of her daughter, who had noticed what she described as a subtle change in her mother over the preceding year. Nothing dramatic, nothing that anyone outside the family would have noticed. A slightly longer pause before finding a word in conversation. A moment of confusion about which day of the week it was on 2 or 3 occasions. A sense that her mother was not quite as mentally sharp as she had been 18 months ago. Evangeline herself was not particularly concerned. She attributed what she noticed to normal aging and to the general mental quietness of retirement. She had been a practicing solicitor for 35 years. Her mind had been under constant high-level demand for most of her adult life. A slowing, she reasoned, was entirely to be expected and entirely acceptable. When I examined Evangeline and took a careful history, her formal cognitive screening was within normal limits. Her standard blood work was unremarkable. Her GP would have been satisfied. But when I asked her specifically about the 5 processes I am about to describe, and specifically about the factors that influence them, I found a profile that was silently accelerating every one of them simultaneously. Disrupted sleep. Mildly elevated blood pressure that was undertreated because her clinic readings looked acceptable. A diet high in processed foods and low in the neuroprotective nutrients her aging brain specifically needed. A marked reduction in physical activity since retirement, and a social life that had contracted significantly in the 18 months since her husband's death. We did not treat Evangeline's brain. We treated the 5 modifiable factors that were accelerating the 5 brain processes. And over the following 12 months, her daughter reported that the subtle changes she had noticed had reversed. Not completely, but meaningfully. Enough that Evangeline herself acknowledged that she felt cognitively sharper than she had in 2 years. The 5 processes were always going to occur. The rate at which they occurred was not fixed. That distinction is everything this video is about. Amyloid beta is a protein fragment produced as a normal byproduct of neuronal activity in every brain. In a healthy brain with adequate glymphatic clearance and efficient metabolic function, amyloid beta is produced during the day and cleared overnight, maintaining a balance that prevents pathological accumulation. In an aging brain, particularly one with disrupted sleep, elevated inflammation, or metabolic dysfunction, this balance shifts. Amyloid beta is produced at rates that exceed the brain's clearing capacity. It begins to aggregate into oligomers, small clusters of protein molecules that are directly toxic to neurons. Those oligomers deposit progressively in the spaces between neurons, eventually forming the plaques that are the pathological hallmark of Alzheimer's disease. The critical piece of information that most people are never given is that amyloid accumulation begins decades before symptoms appear. Research using PET imaging to visualize amyloid deposition in living brains has found significant accumulation in cognitively normal adults in their 50s and 60s that predicts dementia risk in the decades that follow. The accumulation is happening silently. The symptoms follow the accumulation by 10 to 20 years. What modifies the rate of accumulation? Sleep quality is the most powerful single factor. As we discussed in the previous video, the glymphatic system clears amyloid beta during deep, slow-wave sleep. Every night of inadequate deep sleep is a night of impaired clearance and net accumulation. Physical activity is the second most powerful factor. Regular aerobic exercise has been shown to reduce amyloid production and support clearance through mechanisms that include increased cerebral blood flow and upregulation of brain-derived neurotrophic factor, a protein that supports neuronal health. Metabolic control is the third. Elevated blood glucose and insulin resistance significantly accelerate amyloid production and impair its clearance. The practical implication is direct. Protecting your sleep, maintaining regular physical activity, and managing blood glucose are not just heart health interventions. They are active amyloid management strategies. Every night of deep sleep, every 30-minute walk, every meal that does not spike your blood glucose is a direct intervention in the most consequential brain process of aging. Inflammation in the brain is not the same as inflammation elsewhere in the body. The brain has its own immune cells, called microglia, that are responsible for detecting threats, clearing cellular debris, and managing the inflammatory response within brain tissue. In a young, healthy brain, microglial activation is brief, targeted, and self-limiting. A threat is identified, inflammation is deployed, the threat is neutralized, and inflammation resolves. In an aging brain, this process becomes dysregulated. Microglia shift from a surveillance mode to a chronically activated mode called reactive microgliosis. They begin producing inflammatory cytokines continuously, not in response to a specific threat, but as a background state of chronic activation. This chronic neuroinflammation damages neuronal connections, impairs synaptic function, disrupts the blood-brain barrier, and creates an environment in which the small blood vessels of the brain are under sustained inflammatory attack. The vascular consequences of chronic neuroinflammation are directly relevant to stroke risk. Inflamed small blood vessels lose their regulatory function. They become stiff, permeable, and less able to respond to the demands of neural activity. The white matter changes that appear on brain MRI in older adults, the ones that neurologists describe as white matter hyperintensities or leukoariosis, are largely the visible consequence of small vessel disease driven by chronic neuroinflammation. What drives chronic neuroinflammation in the aging brain? Amyloid beta itself is one trigger. Disrupted sleep is another. Elevated blood pressure damages the endothelium of the brain's small vessels, triggering inflammatory responses. Systemic inflammation from metabolic dysfunction, from obesity, from elevated blood glucose, crosses the blood-brain barrier and activates microglia. And loneliness and social isolation, which Evangeline was experiencing after her husband's death, have been specifically and repeatedly linked to elevated markers of neuroinflammation in older adults. The anti-inflammatory interventions that matter most for the brain are not anti-inflammatory medications. They are the lifestyle factors that reduce the drivers of microglial activation. Sleep, blood pressure control, metabolic health, physical activity, and social connection. Evangeline's improvement came when all 5 of these were addressed simultaneously, because neuroinflammation does not have a single cause and cannot be addressed by a single intervention. The blood-brain barrier is one of the most sophisticated protective systems in the human body. It is formed by tightly connected endothelial cells lining the brain's capillaries, supported by glial cells and pericytes, that together create a selective filter, allowing nutrients, oxygen, and essential molecules to pass from the blood into the brain, while blocking harmful substances, pathogens, and inflammatory molecules. With age, and particularly with sustained blood pressure elevation, the blood-brain barrier progressively degrades. The tight junctions between endothelial cells loosen. Harmful substances that were previously excluded begin crossing into brain tissue. Inflammatory proteins from the systemic circulation enter the brain and activate the microglial neuroinflammation we just discussed. The brain's internal environment, which depends on the integrity of this barrier for its precise chemical balance, becomes increasingly compromised. The connection to stroke risk is direct. A degraded blood-brain barrier is associated with small vessel disease, with lacunar infarction, the small strokes that occur in the deep brain tissue supplied by penetrating arteries, and with the white matter changes that predict progressive cognitive decline and increased major stroke risk. Blood pressure control is the single most impactful intervention for blood-brain barrier preservation. The mechanical stress of chronically elevated blood pressure on the tiny endothelial cells of the brain's capillaries is the primary driver of barrier degradation in older adults. Every point of systolic blood pressure reduction, maintained consistently over time, reduces the rate of barrier degradation. This is one of the reasons that blood pressure management in older adults produces cognitive benefits as well as cardiovascular ones, and why undertreatment of even mild hypertension in people over 60 is a brain health risk as much as a heart risk. Synapses are the connection points between neurons, the microscopic junctions across which electrical and chemical signals travel from one brain cell to the next. Your brain's approximately 100 billion neurons are connected through approximately 100 trillion synapses. The richness and density of those connections are what produce the cognitive capacity, the memory, the processing speed, and the mental flexibility that define your intellectual life. From early adulthood and accelerating significantly after 60, the brain undergoes a process of synaptic pruning. Connections that are used frequently are strengthened. Connections that are used rarely are eliminated. This pruning process is not entirely negative. In younger brains, it increases efficiency by removing redundant connections. But in aging brains, where neuroinflammation and amyloid accumulation are simultaneously damaging synapses, the pruning process can become excessive. Connections that would otherwise be preserved are lost. Cognitive reserve, the brain's ability to maintain function despite pathological changes, is reduced. The key insight from decades of cognitive neuroscience research is that the best protection against excessive synaptic pruning is use. the brain's remarkable property of neuroplasticity, the ability to form new synaptic connections in response to learning and novel experience, can, to a significant degree, compensate for age-related synaptic loss if it is consistently stimulated. The more diverse, novel, and cognitively demanding the activities that an older adult engages in, the more the brain's neuroplastic reserves are activated to maintain connection density. For Evangeline, retirement had dramatically reduced her exposure to the high-level cognitive demands that had characterized her working life. The brain that had been building and maintaining connections under the demands of legal practice was now receiving significantly less stimulation. The reduction in cognitive engagement was accelerating the net synaptic loss that neuroinflammation and age-related pruning were already producing. The practical intervention is not a brain training app or a crossword puzzle. It is genuine cognitive engagement with novel, challenging, and socially connected activities. Learning a new language, taking up a musical instrument, joining a class that demands real skill acquisition, volunteering in a role that requires complex problem solving. These activities generate the neuroplastic response that counteracts synaptic pruning at a biological level. They are not metaphorically good for the brain. They are mechanistically protective of it. This is the most technical of the 5 processes, but it is also the one most directly connected to stroke risk, and the one that is most directly modifiable by the behavioral interventions that are accessible to any adult over 60. Cerebrovascular autoregulation is the brain's ability to maintain consistent blood flow despite changes in systemic blood pressure. In a healthy brain, when blood pressure rises or falls, the small arteries and arterioles of the brain automatically constrict or dilate to maintain a constant perfusion pressure to the neurons. This automatic adjustment happens within seconds and is completely invisible to conscious awareness. It is one of the most critical protective mechanisms the brain possesses. With age, and particularly with sustained hypertension, diabetes, and physical inactivity, cerebrovascular autoregulation declines. The small vessels lose their ability to adjust quickly and precisely to pressure changes. The brain becomes more vulnerable to hypoperfusion, periods of inadequate blood flow, during sudden blood pressure drops. It also becomes more vulnerable to hyperperfusion injury, vessel wall damage from sudden blood pressure spikes, during the morning surge and during stress responses. The clinical consequence of impaired autoregulation is an increased vulnerability to both ischemic and hemorrhagic stroke. A brain with intact autoregulation can tolerate the morning blood pressure surge without damage. A brain with impaired autoregulation transmits that surge directly to the vessel walls and the brain tissue, where it causes microscopic damage that accumulates into white matter disease and eventually into larger cerebrovascular events. The 3 interventions that most powerfully preserve cerebrovascular autoregulation in older adults are blood pressure control, regular aerobic exercise, and blood glucose management. Regular aerobic exercise specifically improves the endothelial function of the brain's small vessels, increases nitric oxide production in the vessel walls, and maintains the vascular flexibility that autoregulation depends on. A 30-minute walk 4 to 5 times per week produces measurable improvements in cerebrovascular autoregulation within weeks of beginning. This is not a long-term investment with a delayed payoff. It is a rapidly responsive intervention with measurable impact on one of the most critical protective mechanisms the aging brain possesses. 5 processes: amyloid beta accumulation, chronic neuroinflammation, blood-brain barrier degradation, synaptic pruning and connection loss, cerebrovascular autoregulation decline. All 5 happening simultaneously in every aging brain. All 5 influenced by the same set of modifiable factors. Sleep quality affects amyloid clearance and neuroinflammation simultaneously. Blood pressure control protects the blood-brain barrier and preserves cerebrovascular autoregulation simultaneously. Physical activity supports amyloid clearance, reduces neuroinflammation, maintains synaptic density through neuroplasticity, and preserves cerebrovascular autoregulation simultaneously. Metabolic health, through blood glucose management, reduces amyloid production and neuroinflammation simultaneously. Social and cognitive engagement preserves synaptic density through neuroplasticity while reducing the social isolation that drives neuroinflammation. This convergence is not coincidental. It is the reason that research consistently finds the same lifestyle factors at the top of every brain health risk reduction list, regardless of which specific brain disease is being studied. The 5 processes share drivers, and addressing those drivers addresses all 5 simultaneously. Evangeline's improvement came not from a single targeted intervention, but from addressing all 5 drivers at once. Better sleep through the habits we have discussed in previous videos. Blood pressure management that was taken more seriously and monitored more carefully. Regular walking resumed, initially 30 minutes 3 times a week and gradually extended. A dietary shift toward less processed food and more of the Mediterranean pattern foods that research associates with slower cognitive decline. And social reconnection through a bereavement group and a community legal advice service where she could volunteer her expertise. None of those changes was dramatic. All of them were consistent. And consistency across all 5 drivers simultaneously is what produces the kind of cognitive trajectory change that Evangeline's daughter described at the 12-month follow-up. I want to hear from you in the comments. Which of these 5 brain processes surprised you the most? And which of the modifiable factors, sleep, blood pressure, exercise, metabolic health, or social and cognitive engagement, do you feel is the area where you have the most room for improvement? Your honest answer helps me understand what to focus on in future videos. And the conversation you start in the comments may be exactly what motivates another viewer to make a change they have been putting off. If this video gave you a deeper understanding of what is happening in your brain and what you can actually do about it, please share it. Share it with everyone in your life over 60 who has accepted cognitive decline as inevitable and has never been told that the rate of that decline is profoundly influenced by factors they control every single day. That reframing is the most important thing this video can deliver. Help it reach the people who need it. Subscribe for more honest, research-grounded conversations about protecting your brain and your health after 60. Next time, we are going to talk about the common painkiller that is silently damaging your brain after 60. It is a medication that millions of people take daily without any awareness of its specific neurological risks. That is a video you will want to see before you next reach for the medicine cabinet. Medical evaluation promptly, rather than relying on behavioral interventions alone. This video is a starting point for proactive brain health, not a replacement for clinical assessment when clinical assessment is needed.